Diagnostic solutions company is pitching in to help control the dengue outbreak. LabX has come up with self-test kits as health officials flag an alarming increase in dengue infections. Joining us now is LabX CEO Tom Navasero. Tom, thank you so much for joining us. We're seeing a rise in COVID-19 cases once again since February, not only in the Philippines, but all over Asia and the United States, and even in Europe. And we're also talking about monkeypox cases rising in the US. Now the Marburg virus in Ghana kills 2 people, and now dengue. These viruses are never ending.
No, that's the nature of viruses, Rico. They will keep mutating and we'll never eradicate them. We can only protect ourselves, and either by testing, by vaccination, social distancing, wearing masks. Viruses, we just have to live with them. We just have to live with them.
It will be with us forever and ever. I mean, we've had COVID now for the past 2.5 years and running. And then it keeps on mutating. The Omicron keeps on mutating, and we may now have another virus or another variant of COVID coming soon.
That's correct. And same thing with dengue. Dengue has been with us for hundreds of years. It's just been endemic in the Philippines. It's been with us. We've never got rid of it. And so we just have to find solutions to protect us and save our kids.
And we've seen the number of cases, Tom, over the past year soar by 90% from January to June of this year compared to numbers last year. I mean, for the benefit and education of our viewers, how does one get dengue?
Well, let's look at the big picture first. We have over 400 to 800 million infections of dengue worldwide per year. But out of that, I would say no more than 100 million are actually with a serious issue, and only about 20 to 30,000 actually die. In the Philippines, this increase of 90% probably is due to mobilization. We basically, during 2021, the first 6 months, as you know, we had Delta and all the other lockdowns. That may have kept us from going out and getting bitten by mosquitoes. As of this year, everyone's out, the rain is out, and thus the increase in mosquito bites, increase in both symptomatic and asymptomatic dengue cases.
And what are the initial symptoms of dengue?
Well, they're all like flu, right? That's the thing about dengue. It's almost similar to COVID in a way. Acute flu-like symptoms, severe headache, weakness of body, right? Potential vomiting. Those are the early symptoms of dengue, right? Fever is number 1. But what we don't want is severe dengue. And this is some sign of bleeding internally or in the mouth and so forth. That you don't want to get into.
And of course, when we were talking about 2 years ago, we were talking about antigen tests, right? Which could be a game changer. And it's now here. It's used by many of us. We don't need the RT-PCR tests anymore. We use antigen self-test kits at home to find out if we have symptoms of COVID. But now you have come up with a dengue self-test kit.
Yes,
Can you show us how does this work?
This dengue self-test kit is focused on a specific protein, the NS1 or non-structural protein 1 protein. It's an antigen test because this provides early detection. Remember, if you have enough dengue virus, there's enough antigen to be measured. Thus, you are infectious. Just like dengue, where we promoted antigen testing way back in May 2020, finally, self-testing has been approved after a couple of years. But this is how it works. Dengue is very similar to our COVID self-test kits. This kit comes with 2 tests, and the tests look very similar to our COVID tests. Right? It's a lateral flow device.
It's a cassette, right?
Yeah, immunochromatography, right? So this is designed by LabX. And instead of using mucus in a swab, we basically use a painless lancet, like so. So people really hate this because it pricks, it hurts.
Yeah.
But these ones are developed in Singapore. They are the most painless lancet. Would you like to try?
No, I wouldn't want to try. Not on air. But so how effective?
These are painless. They have a retracting needle.
Right.
They come out, you poke, you add 3 drops of blood into the cassette. It runs for 10 minutes. So within 10 to 15 minutes, you'll know if you are infected with the dengue virus, or called dengue.
Oh, and how effective is this kit? Because the antigen test kits, I mean, they had to go through so much testing, and it showed that they were like 95 to 98% effective, just like the RT-PCR. What about the self-test kits? Does it have the same kind of efficacy?
Yeah, all tests are never perfect, right? There is some chance. So these kits have been around long enough. So we have basically a 97% sensitivity and a 100% specificity. These are way above the mark. So if you test positive here, it's 100% positive, right?
And before you can do, these self-testing, you will have to call a nurse.
That's correct. Thank you for reminding me. But what we do here is we design these test kits, just like our ARIA test kits for COVID, to be guided by a nurse. It's not required, but it's a guided test so that people do it correctly. And more importantly, if the test comes out positive, our nurses or medical practitioners can assist that patient on the spot to guide them on next steps. So key is basically early detection so that they do not, reach severe dengue.
All right, just like when you're positive with COVID, can you get dengue again after 6 to 9 months? I know some people who got COVID 6 months ago and got it again just last week.
Well, with dengue, you can get it next week, right? You don't have to wait till your immunity deteriorates like a vaccine or a past infection 6 to 9 months. Dengue has 4 serotypes. So if you got, say, dengue 1, serotype 1, you won't get it again. But you can get dengue 2, dengue 3, and dengue 4. So it doesn't matter if it's 1 month from now, 3 months from now, you have no immunity to dengue 2, 3, and 4, but only for dengue 1.
But now that we're seeing a rise now, shifting to COVID-19, now that we're seeing a rise, 2,000 cases now a day and rising, how often should we be testing ourselves? Should we only be testing ourselves when we have symptoms like a sore throat or a cold? Or should we always regularly test ourselves like every week, even though we don't feel any symptoms?
Yeah, there's 2 schools into that. One is you want to test to protect your loved ones. That's number 1. So if you're going to visit grandma who has comorbidity or an infant who has not been vaccinated, test yourself. Test the family and caretakers of that child or that elderly person. That's the thing, even though you have no symptoms, okay? 2, if you felt and someone told you that you were potentially exposed, test yourself so that you protect, that and stop that chain reaction. In our office, we test twice a week, right? And that's the thing. Coming here to CNN, you require me to test. That's good, so that we do not infect the workers in the workplace. So testing can be done on a regular basis or just done to protect your loved ones who are weak.
All right, thank you so much for sharing with us LabX new creation, this dengue self-test kit. LabX CEO, Tom Navasero.
Thank you, Rico.